You seem to be in a war with the city over public health funding, and it's a war over numbers. But either way you look at these numbers, Toronto Public Health is going to lose millions in provincial funding. Why is that a good idea? Isn't it the best way to be more proactive and prevent future health problems?
Yes, and we want to work collaboratively with the City of Toronto. I think it's unfortunate that the amount of rhetoric has been amped up to the degree it has, because I am confident that the essential programs that Toronto Public Health is meant to deliver will be delivered, even with the changes that are happening over the next 3 years.
But if it's millions, then Toronto is going to have to pick up the slack. In essence, this is downloading.
No, it isn't. There's some uploading and some downloading happening here, because
What's the uploading, Minister?
we have just introduced a dental program for low-income seniors that costs $90 million annually.
Province-wide?
Yes, province-wide. $15 million of that is for patients who live in the City of Toronto. Toronto is currently covering that as part of public health, but this will give them another $15 million to provide other public health programs.
But they're still out several million more.
Yes, they are. But the differences that the province has calculated and the differences that the City of Toronto have calculated are vastly different.
Yes.
We have a big difference of opinion in that, so I would look forward to sitting down with Mayor Tory and talking to him about the differences and how that can be dealt with in terms of setting priorities and making sure that the essential public health items are going to be covered. Because there are some things that the City of Toronto does that personally I wouldn't consider to be priorities. They have a whole advocacy department within public health. Why that's necessary, I don't know, because I think everyone is in favor of public health initiatives. They've also spent some money on some reports.
What's the price tag on that, Minister?
The specific price tag would be part of their overall budget. I don't have the specific amount, but there's some other programs. They've done some studies on reimagining Yonge Street as a result of making some changes and making it more walkable and so on. Again, is that a priority when you compare that to a breakfast program for a child or a vaccination program? I don't think so, nor do I think the people of Toronto feel that way.
But are those numbers, are those departments negligible in the overall budget, or is it a huge proportion? Because that makes a big difference.
No, they all have significance, and I think it's also important to note that over the past 10 years, the City of Toronto Public Health Unit has run a surplus totaling in total $52 million. So it's about $5 million per year that they have in excess of what they spend.
So your first answer was you want to be collaborative with the city. How is it collaborative when these cuts come without warning? Shouldn't you have sat down with them first to explain all of this?
We did speak in advance prior to the budget with the people in the City of Toronto. They did have this information. We've had numerous conversations with them, both prior to and following the budget. So it is something that we want to sit down and work on with them to make sure that these essential programs can be covered, and I am confident that they can if the appropriate priorities are set.
So breakfast programs, vision for kids, the restaurants, food safety.
Yes.
All these things, are they sacred? Is there anyone that you would allow to fall?
No, all of those programs are sacred. They are all necessary. I agree that they are all important, but the programs and services where we have based our calculations on the budget that was given to us by the City of Toronto. So that is what we are taking a look at. We know that they need to be able to provide those programs, but I think in terms of their overall budget at the City of Toronto, people have heard recently about a tree maintenance company that was not doing their job properly. They were watering stumps, and the GPS records show that they weren't at the appropriate locations, that they were doing other things, but they weren't doing the jobs that they were contracted to do.
Sure, but I think any city, any government in any province, for example, will have these things, and it's come to their attention, and it sounds like the mayor is going to do something about it. So aren't we muddying the waters by bringing that in here?
No, I don't think so, because it is all part of one big budget, and so if millions of dollars are being wasted in certain areas, then that is an important consideration. People want their tax dollars to be spent properly, and that is the responsibility of the administration in Toronto to make sure that that money is well spent. In public health, as it is with with tree maintenance or in fleet maintenance as well. There's also a fleet of vehicles that the municipal government overspent on, $10 million, $314,000 I believe it is per year to maintain, and yet these vehicles aren't being used. And the people who are driving, should be driving these vehicles, are being paid additional amounts for personal compensation for mileage.
You are escalating the war with the city here, Minister.
I don't want to do that, but what I do think is important, because the people of Ontario expect their provincial government to spend their tax dollars wisely and to spend it on priorities. I think it's reasonable for people to expect that the City of Toronto will do the same.
Let's switch to the protests that are going to start in the next 2 more questions. Thank you. Yes. Let's start with the protests now that are going to be starting at noon today. Thousands are expected to come. They're saying 8,000 is the prediction. And they're concerned about healthcare cuts and privatization. What do you say to the protesters who will be out on the front lawn today?
I would say that they have incorrect information. In fact, we are spending $1.3 billion more on healthcare in this year's budget, and we are spending it to strengthen our public healthcare system. So we have committed $27 billion over the next 10 years for capital projects like building new hospitals and so on. We're spending $400 million more this year on operational funding for hospitals, $174 million more for mental health and addictions programs, all within our public systems. So,
but it's not keeping up with inflation. So I know you're in this, in essence, because it's not keeping up with inflation, it's going to be less.
No, it is an increase. $1.3 billion is an increase.
But
and
not
we are
above
spending,
inflation.
It is actually, and
Is
we
it,
are
Minister?
going to be spending more money on all of these projects. And so when I hear the Ontario Health Coalition talk about privatization, I really wish they could be more specific with me about what it is they're talking about, because we already have some private care within our delivery system. Doctors who are in a private practice, for example, are business people. They are privately operating. Do they want us to get rid of doctors in our system? I don't think so, but there's nothing in Bill 74 now enacted, the People's Health Care Act, that indicates anything other than what we are doing, which is to strengthen our public healthcare system. I am committed to that. Our government is committed to that.
Last question, because Haley's frantically giving me the wrap.
Yes.
Do you anticipate, because they are very concerned about privatization,
Yes.
and I agree with your point, there's already some areas where it is privately put forward, but do you see expanding that in any way whatsoever?
The focus of Bill 74, the People's Health Care Act, is really to change the way our system is being operated, because we know it's under tremendous strain and it's not centered around the person. So we need to, first of all, recenter that, make sure that we provide the care that people want and need, and connect that care throughout their healthcare journey, whether they're in hospital or at home, and to make sure that all of the healthcare providers, instead of being operating in silos with different funding envelopes, all work together to provide that public care for people. So that's the reason why we're doing this.
But that wasn't the question. It was, do you anticipate in any way expanding the private delivery of healthcare?
That is not the primary goal right now, no. The primary goal is to strengthen our public healthcare system in the way that I've just described.
Minister, thank you.
My pleasure, thank you.